Have you ever heard of edging? Today, we're going to go over everything about it, the benefits, the drawbacks, and whether it's actually safe. I'm Dr. Rena, a urologist and pelvic surgeon, and if you're new here, be sure to subscribe and share this channel with your friends. Edging is often defined as controlling orgasm, or bringing yourself close to climax and then stopping before reaching it, in order to delay the actual release. This can be practiced alone or with a partner, and it can be part of different types of sexual activity, including oral, anal, or penetrative sex. So, why do people practice edging, and what are the benefits? First, it may help increase pleasure. The idea is that by delaying orgasm, tension continues to build, leading to a more intense release when orgasm finally happens, which can heighten overall enjoyment. Second, it can help strengthen your connection with a partner. When done together, it creates an opportunity to explore and understand each other, and even try to sync your orgasms, which may feel satisfying and deepen intimacy. Third, it can be a learning experience. Edging allows you to recognize which types of stimulation feel more pleasurable and which do not, helping you better understand your body and what leads you toward orgasm, or how to slow it down. Next, it can give you more control. Some individuals want to manage how long they last, which can extend the duration of intercourse and potentially increase satisfaction for both partners, as mentioned earlier. Lastly, a similar approach is often recommended for men dealing with premature ejaculation. I've made several videos on that topic, so be sure to check those out. In simple terms, premature ejaculation is when climax happens sooner than desired, often within the first couple of minutes of intercourse, and it can be frustrating. The stop-start technique involves pausing for about 30 seconds when you feel close to climax, and then continuing. In some cases, a gentle squeeze of the head of the penis can also help delay orgasm before resuming activity. So, how effective is this method really? Most of the information we have actually comes from research on premature ejaculation. There isn't much solid research on people using edging purely for pleasure or simply to try something different. However, there is one interesting study that looked at 36 couples and divided them into two groups. One group used the traditional stop-start method, which urologists often recommend to help patients manage premature ejaculation. The other group used alternative techniques to delay ejaculation without stopping sexual activity, allowing things to continue, something that likely reflects how many people practice edging at home. The study first explained what happens in the body during sexual arousal. As your body becomes more excited and approaches the point of no return, several changes take place. Muscle tension increases, including in the abdominal muscles, pelvic floor, and gluteal muscles. Breathing becomes faster and more rapid. Many people begin to move their pelvis more forcefully, and there is a strong focus on the sensations that are creating stimulation, along with an increase in movement and overall pleasure. So, how can climax be delayed? The key is to extend this arousal phase. The study suggests a few helpful techniques. One is practicing abdominal or belly breathing, also known as diaphragmatic breathing. As mentioned earlier, breathing tends to become quicker and more shallow during arousal, often using the chest. Shifting to slower, deeper belly breathing can help relax the muscles and reduce excessive tension. Another suggestion is to focus on maintaining moderate intensity instead of going too fast or too forcefully. Slowing things down and being present with the sensations can help you enjoy the experience more, rather than rushing toward climax. The researchers also emphasized that trying to distract yourself with non-sexual thoughts is not helpful. In fact, it can create discomfort or anxiety and may take away from the overall experience. In this study of 36 couples, the researchers measured the time it took to reach ejaculation, known as intravaginal ejaculatory latency time, using a stopwatch. In the study, the female partner was asked to measure the time from the start of intercourse to ejaculation. They recorded this before the treatment, right after the treatment, and then again 3 months later. What they found was that, initially, most participants reached ejaculation in under a minute. After practicing these techniques or using the stop-start method, many were able to extend their intravaginal ejaculatory latency time to about 7 minutes. In other words, they went from lasting less than a minute to around 7 minutes before reaching climax. So clearly, these methods can be effective and may offer the potential for increased pleasure. But what about the downsides of edging? Some of these I mentioned in my previous video on masturbation habits that may negatively affect your sex life. One possible issue is something commonly referred to as blue balls, medically known as epididymal hypertension. This happens because, during arousal, blood flow increases to the pelvic region, including areas around the testicles. Normally, this buildup is relieved during orgasm. But if climax doesn't occur, the blood can remain in the area, leading to a feeling of heaviness, pressure, or discomfort. This can sometimes happen with edging. Another concern is what's called idiosyncratic masturbation. If edging is done frequently during solo activity, you may become very accustomed to a specific type of stimulation. For example, using your hand, or for women, relying heavily on toys, can become your preferred method. Over time, this may make it harder to reach climax with a partner, since a vagina may not provide the same level of pressure as a hand, or a penis may not replicate the sensations of a vibrating device. Lastly, edging can sometimes contribute to delayed ejaculation, difficulty reaching climax, or general dissatisfaction. When you're close to climax and then stop stimulation, it can lower your level of arousal. For some individuals, it may be challenging to build that same level of excitement again. This can lead to frustration, discomfort, and even a sense of pressure, especially if you feel expected to perform or reach climax at a certain time. It's really important, of course, if you're planning to try edging with a partner, it's important to talk about it beforehand. Make sure you're both comfortable, on the same page, and that you're both consenting adults who want to explore it together. Lastly, I want to address a few common questions I often get about edging. So, how long should you edge for? The truth is, it really depends on you as an individual. There's no fixed right or wrong duration. As I mentioned earlier, studies on techniques used for premature ejaculation show that they can extend intercourse by about 7 to 9 minutes. Is that a reasonable time frame? For many people, yes. That said, some individuals may go up to around 30 minutes if they're using edging to enhance pleasure. As long as it's not interfering with your daily routine, your quality of life, or your overall happiness, there's generally no issue with doing what you enjoy. However, if you notice that you're engaging in edging very frequently, or you start experiencing discomfort or a constant feeling of tension in the pelvic area, it's something to pay attention to. While it's uncommon, I do see some individuals who develop ongoing pain in that region due to excessive edging. So, if you feel well, your life is balanced, and both you and your partner are satisfied, there's typically no harm in practicing it. Another question I often hear is, what happens to semen if you don't ejaculate? Does it build up in the body? The answer is no, nothing harmful happens. Your body will either naturally reabsorb the semen, or you may release it later during sleep through what's known as a nocturnal emission. As always, I hope you found this helpful and learned something new. And remember to take care of yourself, because you truly deserve it.